So if you've got psoriasis that's failing to respond to standard creams, there are two main options in terms of treatment. The first is to think about going on ultraviolet phototherapy, and the second is to go on an oral drug. And there are two main drugs, methotrexate, which is covered in another video, and acitretin. So acitretin is a different kind of drug to methotrexate in that it's derived from the vitamin A, and it works purely on the skin. It does not suppress the immune system. It was developed in the late 1980s, so we've got over 35 years of experience in using it. It doesn't tend to have many severe side effects. Do you have any specific questions you want to ask?
Well, how likely is it that acitretin will work for my psoriasis, and how long will it take before I get better?
It's difficult to give an exact figure for how likely it is to work. Certainly over 50% of people will respond and respond quite well. Overall, it may not be quite as effective if you look at everybody who takes it in comparison to methotrexate, but I'm guessing probably about 2/3 of people do respond to it. A bit like methotrexate, it takes a little while to work, probably at least several weeks, but usually it's a couple of months before you see a reasonable effect on the psoriasis. It'll depend a bit on the dose, and we usually start at a lowish dose in case you have any problems with side effects.
And are there any possible side effects?
Yes, the commonest side effect is dryness of the skin or the lips. Usually that's not too severe. And then there's a related side effect which is not uncommon on the drug, which it can cause slight peeling of the palms and soles, usually not a big problem for patients. Other than that, there aren't many common side effects. Occasionally people will get minor aches and pains in their joints and ligaments that can be worse if patients exercise. If you do get that, then reducing the dose will usually remove those. The patient information also documents hair loss as a side effect, but that's really very uncommon, and it would usually regrow if you did lose any hair. And then finally, if you've got diabetes, some patients with diabetes, their blood sugars become a little bit more difficult to control, but most people don't have a problem with it.
And would I be able to start a family if I'm taking it?
It's an absolute no-no for a woman to get pregnant on the acitretin. The reason is that there's a very high likelihood that a child will be born with significant abnormalities. So, bar a few exceptions, we never prescribe acitretin to women of childbearing age. The other reason for that is that the drug persists for 3 years in the body after you stop it. So that's another reason why it becomes much more complicated giving it to women who may want to have a child in the future. If you're a man and you want to father a child, however, there's no good evidence that acitretin affects sperm production or quality, so you can father a child whilst you're on acitretin.
Okay. I mean, if I do go ahead with the treatment, do I need any tests before I start? And do I have tests while I'm on the treatment?
So you would have a few routine blood tests before you start. The main things that are measured are liver function tests and also the amount of fat in your blood. Sometimes you can get slightly higher levels of fat, including cholesterol, in the blood when you're on the drug. Sometimes liver function tests can go a little bit awry, but that really rarely causes a significant problem. And when people are stable on the drug and it's working well, we measure those blood tests about every 4 months.
Okay. I mean, what are the practical aspects of taking the pills?
So it's a daily drug. It comes in different size capsules of different strengths. So it comes in 10 milligram capsules and 25 milligram capsules. And most people will be on a total daily dose of between 10 and 50 milligrams a day. So depending on what dose you're on, it could either be a multiple of 10 or a multiple of 25. Because it's derived from vitamin A, which is absorbed best if there's fat in the stomach, this drug needs to be taken after food, because otherwise if you take it on an empty stomach, it won't be fully absorbed.
Okay. And are there any issues about vaccinations under drug?
Because it's not affecting immunity, then it's fine to have any vaccination whilst you're on the drug. It shouldn't affect any of that. There is an issue about blood donation with this drug, mainly to do with the fact that the drug needs to be avoided in women who want to have a pregnancy. So obviously there are traces of the drug in the blood, and a blood transfusion wouldn't be a good idea for a woman. So people are advised against no blood transfusions or no blood donation whilst they're on the drug, and not for 3 years after stopping the drug either.
Okay, and would it interact with any other medicines that I might be taking?
Very rarely. The two drugs to watch out for are tetracyclines, which are commonly used to treat things like acne, which very rarely can interact. And the other one that people forget about is vitamin A itself, which the acitretin is derived from. You can get problems if you have too high levels of vitamin A. So in terms of practical advice, you shouldn't take vitamin A supplements, and you're probably best avoiding general vitamin supplements which might contain vitamin A.
Okay, well, thank you.